Clinical case vignette hypoparathyroidism. A 50-year-old woman presents to the emergency department with muscle cramps, tingling in her hands and around her mouth, and a recent episode of carpopedal spasm. She underwent thyroidectomy 2 weeks ago for thyroid cancer. On physical examination, BP 110/70 mm Hg, HR 75 BPM, temp 90-98.2 Guferrices, positive facial muscle twitching with facial nerve tapping, positive trossocine, carpedal spasm after inflating BP cuff. No thyroid enlargement or nodules. Laboratory results: serum calcium 6.8 mg/dL low, normal 8.5 to 10.5 mg. Serum phosphorus 5.2 mg/dL high, normal 2.5 to 4.5 mg/dL. PTH 8 pg normal 10 to 65 pg. Vitamin D normal. Magnesium normal. The patient is diagnosed with post-surgical hypoparathyroidism due to parathyroid gland removal or injury during thyroidectomy. Question 1. Which of the following best explains the pathophysiology of this patient's symptoms? A. Increased osteoclastic bone resorption leading to calcium loss. B. Decreased PTH secretion causing low calcium and high phosphorus. C. Impaired intestinal calcium absorption due to vitamin D deficiency. D. Excess renal calcium excretion due to hypoparathyroidism. Answer. Rationale. Hypoparathyroidism leads to low PTH, which reduces calcium resorption from bone, decreases renal calcium reabsorption, and reduces intestinal calcium absorption, resulting in hypocalcemia and hypophosphatemia. Question 2. What is the most appropriate initial treatment for this patient? A. IV calcium gluconate. B. Oral calcium and vitamin D. C. Recombinant PTH therapy. D. Thiazide diuretics. Answer. Rationale. This patient has symptomatic hypocalcemia, muscle spasms, paresthesia, Trousseau's and Chvostek's signs, which requires IV calcium gluconate for rapid correction. Oral calcium and vitamin D are used for chronic management. Question 3. Which of the following electrolyte imbalances should also be monitored in this patient? Hypomagnesemia, hyperkalemia, C. Hyponatremia, hypophosphatemia. Rationale. Magnesium is essential for PTH secretion, and low magnesium levels can worsen hypocalcemia. Hypomagnesemia should always be corrected first in patients with hypocalcemia. Question 4. A patient with chronic post-surgical hypoparathyroidism is on oral calcium and calcitriol, but continues to have low calcium levels. What is the next step in management? A. Increase dietary calcium intake. B. Start recombinant PTH therapy. C. Add bisphosphonates. D. Stop vitamin D therapy. B. Rationale. If oral calcium and vitamin D are insufficient, recombinant PTH therapy, teriparatide, can be used for better calcium regulation in chronic hypoparathyroidism. Would you like any modifications or additional questions?